Tools of the Trade, Oral Care Products That Help, Series 2. The basic oral care supplies are listed above in this slide. It is good to have everything prepared in advance. To be able to do oral care well, these are the basics that are needed. The 4x4 gauze is listed because it is preferable that since it's being used in the mouth, it is something disposable. However, there are homes and facilities that prefer to use a washcloth. Listed here are the criteria for choosing a toothbrush. Toothbrushes should always have soft bristles. The head should be small. This allows you to be more thorough with brushing. Sometimes people use a brush with a larger head thinking that they can cover more area in a shorter space of time. However, what really happens is that areas are missed, so it's important to have a small head on the toothbrush. Toothbrushes should be replaced once they are frayed. Once they are frayed or dirty, they are no longer effective. The cost of using this method may be a concern, and while it's true that toothbrushes such as the one that you see here in this picture do cost more than other toothbrushes, in the long run these toothbrushes do not have to be replaced as often as inexpensive toothbrushes. The inexpensive toothbrushes do not last very long and they're not good, so they have to be replaced a lot more often. The effectiveness of the toothbrushes such as what you see in this presentation make the cost well worth it. You will notice that the third bullet lists a wide rubber handle toothbrush as one of the criteria. The reason for this is shown here. This is the two toothbrush technique. Sometimes you're not confident that a resident will not bite down on your fingers, so you're not comfortable putting your fingers in the mouth. Also, too, to be able to clean the inside of the teeth, if the resident will not cooperate with you to open their mouth, then you cannot get inside. So one toothbrush, the handle of it, is used as a prop, and this will keep the mouth open while the other toothbrush can be used to brush the teeth. Since one is being used as a prop, the handle has to be large enough and fat enough and rubbery enough to grip the teeth without causing any discomfort, and so that it won't slip. Some have tried using wedging devices or mouth props. While dental clinics do use these for dental treatments, we do not recommend the use of them because it can be a choking hazard. A toothbrush is the preferred tool as a prop because you can keep a good grip on it as the caregiver, and so you minimize the chances of choking. Some have also wrapped about 6 tongue depressors with material hospital adhesive tape and use this as a mouth prop. While the caregiver can keep a good grip on the tongue depressor, we cannot overlook the fact that if it's in the mouth for an extended period of time, it can become moist due to saliva, and if the resident was to clamp down on it, it could become a choking hazard. If toothpaste is being used as the cleansing product, then only a pea-size amount is to be used. With cleansing products, it's important to recognize that if a person does not have the ability or is not cognitive, they may be swallowing the product. If the caregiver cannot ensure cooperation from the resident, then you should not be using toothpaste. If they cannot rinse and spit and swallow, then they may choke on the toothpaste. Therefore, it's used only if they can demonstrate to you that they can and will cooperate to rinse and spit. If a person has a dry mouth, you may try using a toothpaste that is for dry mouths, as shown in the slide. Paravex is another product that you see in this slide. It does not foam up like toothpaste, and the taste is not too strong for most people. You may want to consider this as an alternative. Unfortunately, Paravex does not contain fluoride. We know that fluoride is important to the oral health of everyone, including those in long-term care homes. It is important to keep in mind that Paravex should be used for compromised individuals. If an individual can cooperate to rinse and spit, then they should be using fluoridated toothpaste. You'll notice that there was no dental floss listed in the list of basic supplies. Flossing is an extremely important part of oral care. However, the challenges that our clientele face can make it very difficult to impossible to floss. So while nothing replaces flossing, there are alternative tools that can be used. In this slide, we see some examples of a few different products. Stimudents and soft picks remove plaque from in between the teeth and massage the gum tissue, as shown in the diagram above. You may recognize the end-tuft brush from the first slide as one of the basic tools. This brush is good for cleaning along the gum line and for cleaning around the entire tooth. The pictures on the next slide show how this tool can be used. This is an example of how the proxy brush or end-tuft brush is used. Sometimes people have only 1 or 2 teeth at the very back of the mouth. This type of brush is small and therefore can make it easier to get behind the tooth and clean it. It is important because cavities can start in these hard to reach areas because they are not cleaned well. So it's really important to get behind these teeth and clean all around them. Listed here are some of the basic supplies for denture care. The denture box is used to store dentures. Dentures should never be stored dry, as this can make them brittle. A denture brush, not a toothbrush, should be used to clean the denture. It should have a pointed side. The pointed side is very effective for cleaning the inside of the denture. The denture labeling kit, which is seen on the lower left corner of the slide, is important because dentures should always be labeled. This can be done by a dentist or a denturist. However, if the home or facility can purchase a denture labeling kit, it can also be done by a staff member. There are different brands, but what it contains is essentially the same. You want to choose a location on the denture that is inconspicuous to put the name on. The kit comes with what looks like little pieces of steel wool. This is used to roughen a small surface of the denture. Then, with the pencil provided, you write the name of the person or the initials, whatever can fit. Then, with the bottle that looks like nail polish, clear nail polish that's provided in the kit, you paint over the name. You let it dry and then paint with another coat. There are various cleaning agents that can be used to clean the denture. Bleach is not one of them. It is important to remember to read the label of the cleaning agent and make sure that the cleaner can be used on partial dentures. Persistent stains and deposits should be moved by an oral health professional. Examples of those persistent stains may be things like an iron supplement stain. Also, denture paste can be used to clean the denture. It will not scratch the denture as regular toothpaste will if it is used to clean the denture. A caution: if a denture tablet or the liquid from a denture is left unattended, This could be dangerous as it can be accidentally swallowed or choked on. All oral health supplies for each individual should be labeled. For various reasons, such as a person is taking multiple medication or has had cancer treatment or they have a genetic disorder, they may have dry mouth. When a person's mouth is dry, it often appears glossy and red, and a person may complain of the dryness. If you were to touch the oral tissues with a gloved finger or gloved hand, your glove will often stick to the tissues if the mouth is dry. This can be very uncomfortable for the resident. Therefore, you want to encourage them to drink water if it's possible. Also, you can use a mouth moisture agent, such as what you see displayed in this slide. These can be applied to all the oral tissues, the tongue, the ridges, the roof of the mouth, etc. It is also important that the doctor be informed that you are using a dry mouth product. Whether you are using a product for dry mouth or for dry lips, always use a product that is not petroleum-based, as this can clog the pores. This is not healthy for the tissue. If you are using a lip balm, you want to also ensure that it is water-based. It is not necessary to use mouthwashes routinely if the mouth is healthy and clean. However, if you choose to use a mouthwash, use one that is non-alcohol based, and this is because the alcohol is drying to the tissues. So a non-alcohol mouthwash will be less drying for the oral tissues. However, there are times when mouthwashes are recommended by an oral health professional, and it's for various reasons. Sometimes a dentist may prescribe chlorhexidine. Chlorhexidine is used to treat gum disease as it reduces plaque and it fights gingivitis. However, some of the side effects of prolonged use are dental staining and increased tartar, and it may even alter the taste of certain foods. So use it as directed by the dentist. To aid you in effective use of your time, it is important to use good management tools. Some examples of management tools are the Oral Health Assessment Tool and the Daily Oral Care Plan. These are validated and outcome-driven tools. The Daily Oral Care Plan helps you to know exactly what care is needed for a person. If you are taking care of someone for the first time or someone that you do not usually care for, you will know exactly what to do instead of wasting time trying to decide what needs to be done. These tools are effective for all residents. Oftentimes, the question arises, where can I find these tools? This slide and the next are a list of where you can find the various tools of the trade. Please note that some of these companies have a minimum order, so you may not just be able to order one item of each product. Please note, this is only a sample list of the companies that provide these products. These products and others like them are also available through other companies. This is a list of a number of resources and websites that you can refer to for more information. Thank you.